Every year as we come into spring and summer, there are many animal health issues front of mind, and pinkeye is one of them in many regions. Pinkeye is a highly contagious bacterial disease that causes significant pain and discomfort to the animal and may lead to permanent blindness. It is most often seen in young cattle and can reduce their growth performance, and any scarring on the eye from healed lesions that is evident at sale time can lead to reduced prices or rejection, particularly at feedlots. Pinkeye is what is referred to as a multifactorial disease, meaning there are a number of factors that contribute to its development. Young cattle or cattle with a compromised immune system are more vulnerable. The environment is a big contributor. Anything that irritates the eyes increases the chances of pinkeye developing, such as high UV, dust, long grass or stubble. Flies are often involved in the rapid spread of the bacteria between animals. High stocking rates and/or supplementary feeding also increases the chance of spread and the stress on the cattle, which impact on their immunity. The most common pinkeye bacteria is Moraxella bovis, but there are a few other bacteria that can be involved, such as Moraxella bovoculi. These bacteria can be present in the eye all year and cause no disease until other risk factors come into play. There's not one thing alone that will control pinkeye. Essentially, you need to address as many of the contributing factors as possible to achieve the best level of control. There are many factors we can't control, such as age, UV, temperature, and some which we can only try to reduce, such as dust or long-seeded grass. If we focus on what we can have some control over, this will definitely deliver results and less pinkeye. Calves will always be more susceptible, but ensuring good nutrition and moderate stocking rates will help reduce cases. Controlling flies will have a major impact in reducing the transfer of the bacteria between animals. Once the fly season begins, treating with a product such as Cooper's Easy Dose will reduce fly numbers and reduce pinkeye cases spreading. Dust in the yards can be controlled to a degree if we can wet yards down, but also minimising the number of times the cattle need to be yarded will help. Spread occurs during yarding due to the close contact. Try not to graze young animals in paddocks with tall standing feed or have lots of thistles, as this can irritate and damage the eye, leading to an increased opportunity for the bacteria to attach to the cornea and cause disease. If supplementary feeding, don't feed high dust rations or really stalky hay if possible, and have hay racks low so the animals don't reach up and have the hay fall into their eyes and cause damage. Vaccinate with Cooper's Piligard vaccine before the onset of the fly season to help in the prevention of bacterial infections. A prevention program that targets the animal's immune status, the environment and the bacteria through vaccination and implementing strategies against all three components will deliver the best result in the control of pinkeye on farm. In a pinkeye program, the first part to implement is the Cooper's Piligard vaccine, which requires a single shot each year before the pinkeye season. Best results will be achieved if this is given 3 to 6 weeks prior to the pinkeye season in your area. For example, if you are in an area where most cases are seen from late December, you should vaccinate around late October to make sure immunity is at the highest level by the expected time of challenge. If your region has an extended pinkeye season over spring and autumn, contact your Cooper's representative to discuss the most appropriate vaccination program in your circumstances. Fly control utilising a product such as Cooper's Easy Dose is best administered once fly numbers are noticeable. Don't wait until numbers are high, as it is then very hard to get on top of them, as there will be so many eggs and larvae around. You can expect to get about 6 weeks control against nuisance flies, but if the fly population is high before the first treatment, you may need to treat again during the fly season. The Moraxella bovoculi bacteria causes an aggressive pinkeye that typically results in rapidly developing nasty pinkeye lesions. Both in Australia and the US, it has been found that on farms that have Moraxella bovoculi, the majority of them also have Moraxella bovis. There is not a vaccine in Australia to help control bovoculi, so when this is present, the environmental conditions become even more important, such as fly control, stocking rate, assessing and minimising anything that causes eye irritation in the paddock or in supplementary feeding situations. In most cases, it is still worth vaccinating with Piligard to help control the bovis portion of the pinkeye outbreak and reduce the overall number of cases. If you know or suspect you have bovoculi on farm It is best to seek advice for your particular situation from your advisor or your local Cooper's representative, as the program to minimise pinkeye in these situations varies between farms. By implementing a pinkeye prevention program, you will have a significant reduction in cases, which will reduce the need to yard cattle to treat cases. This also helps minimise spread and will reduce the financial impacts when selling stock due to lower prices or rejection of cattle with eye scarring. If you'd like to know more about managing pinkeye in cattle, get in contact with your local Cooper's representative on 1800 226 511 or visit the Cooper's Animal Health website. Your Cooper's representative will reach out to the Cooper's Tech team if need be.